Now, this another. There are some topics called easy topics answered wrongly in a silly way. You can come out with a list of topics. Absolute relative contraindications, doctor. Everything looks like contraindication. Just like for Duryodhan in Mayasabha. You don't know which is absolute, which is relative unless you are prepared. So don't make a mistake. You have 10 things to remember which are called absolute. Thromboembolic history, liver dysfunction, suspected carcinoma, undiagnosed genital malignancy, undiagnosed genital bleeding, known or suspected bleeding, or known or suspected pregnancy. I leave to the list, but you need to know which is absolute, which is relative. Next follows the relative. I think forget about absolute, remember relative, that's more easier because the list is smaller. Hypertension, headache, myoma, gestational diabetes, elective surgery, seizures. I think this is a easier list, 6 conditions which are called relative, because in exam absolute relative के बीच में correctly answer करने में talent है, पूरा talent. Now, coming to the control pill, it can lead to glucose intolerance and diabetes can be precipitated. Okay, doctor, tell me 2 rapid acting insulins and Detimer. Detimer is it long acting, intermittent acting, short acting, ultra short acting? What do you call it as? How many say short acting? Can raise the hand? 1, 2, 3, 4. That means others agree that it is long acting. Huh? Colonel correctly answers. Lispro Aspart, the rapid acting. Detimer is long acting, doctor. Detimer Glargine, long acting. NPH is intermediate. Aspart Lispro is rapid acting. Regular insulin रहता ना, कब देते regular insulin को? DKA patient comes to you, what will you ask nurse to give? Sister, 50 units of insulin in IV drip, running normal saline drip, running at 50 microdrops per minute. After that 40, 30, 20, 10, and give 15 units, one shot. What will nurse will be doing? She will give 50 as a shot and put 15 in that. So, and she runs that 15 also at 15 drops. So that's the reason 50, 15, 50, 15 you need to have good practice while instructing the nurse. Huh? Okay. Typically, what will estrogen in the OCP will be doing in addition to creating thrombus? It will suppress the FSH levels. That's how it will create anovulation. Now, prenatal diagnosis in the second trimester. Do you need to do amniocyte cultivation for identifying neural tube defect? Not required. All the remaining are true. I think very easy question. During the first 6 months, extension of the lug, if you do vertical suspension, is definitely pathological. All the remaining are the false statements. It is the CMV nuclear antigen in the urine by immunofluorescence is considered to be the best and specific way to confirm the congenital CMV infection is what need to be remembered. Coming to the mean arc, obesity prepones the mean arc because of the peripheral estrogenization. Then should be an answer, doctor. The last interactive question before we sign out for this today's evening to see a better day tomorrow evening. Inferior pantanoduodenal is a branch of superior mesenteric artery. Huh? Okay, then superior pantanoduodenal is which is a branch of Hepatic artery. I think the first answer is correct. First is SMA, pakka. Okay, gastroduodenal is an answer we get from Karnool. Raj says inferior is superior mesenteric, and Madhuri says superior mesenteric and celiac. So doctor, you have inferior epigastric branch of exiliac. Superior epigastric is a branch of internal thoracic and mammary. Superior pancreaticoduodenal is celiac, as rightly said by you. Inferior pancreaticoduodenal is superior mesenteric artery. Middle colic is SMA, left colic is IMA. Superior rectal is IMA, middle rectal is internal iliac. These things are very important when your aorta get blocked, because they form basically collaterals here and there, and these are the frequently asked 8 questions in the entrance. Why these 8 to be remembered? Because middle is kahin aur se aa rahe hain, inferior is somewhere else, superior is somewhere, middle is somewhere, hence. Okay doc. 1-year-old child may health circumference is 42 is normal or microcephaly. Weight is definitely not 8 kgs unless he is monstrous. Now herpes simplex commonly is treatable with antiviral drugs. Early infancy में lobar pneumonia is very common, is what need to be remembered. Yes, I am unable to get the question of the Sunain who says superior pancreatico. I'll come to that point later. Yeah, anomalous pulmonary connection. What is the meaning of anomalous pulmonary connection, doctor? Connection का मतलब क्या है? Normally pulmonary veins drain into left atrium. Instead of that, if they form one common vein which drains into right atrium, then you call it as anomalous pulmonary venous connection. Now how can they drain into right atrium? Either they can drain directly, they can drain into SVC, they can drain into IVC and then into the right atrium. Accordingly, you have a supracardiac, infracardiac and intracardiac. 3 types of anomalous pulmonary venous circulation. Generally, infracardiac type is often obstructive in nature and it is not always associated with VSD. Why VSD or ASD should be there intact? Because it is abnormally entering into right side. Once more it should be pushed back into left side. Hence you need to have either VSD or ASD available. Even foramen ovale which is persistent also can be associated in some people without VSD. In some people VSD can be associated. Either VSD or parent foramen ovale nahi hai to baby will die in utero is what need to be remembered. If there is a unprovoked febrile, not ephemeral, febrile, then do you need to basically give anticonvulsive treatment? No, not required. You need to control the fever, reassure the mother. That's what need to be fundamentally done. So that's all the story, doctor.